Hello and welcome. My name is Dr. Herb Greenman, and it's my pleasure to guide you on a journey from cataracts to improved vision. When we think of the eye, we can think of it as a camera. Just as a camera has a lens in it that helps to focus light and images onto the film, your eye has a lens in it that helps to focus light onto the retina. Over time, and with certain diseases such as diabetes, the lens in the eye can become cloudy. With cataract surgery, we remove this cloudy lens. You can also think of the lens or the cataract such as an M&M. We make a circular opening in the shell of the M&M and then break up and remove the chocolate part. In the shell of the M&M, we place a new lens. Over time, the lens capsule or shell of the M&M will shrink wrap itself around the new lens. There are several options for cataract surgery. The basic lens or the lens that the insurance covers will give you very good distance vision. It's a monofocal lens, so it focuses light at near or distance. Most patients choose distance vision. It does a great job as long as you don't have astigmatism. With the basic lens, if you're trying to read something from arm's length in, such as a newspaper or see the computer or read a book, you'll need some help in the form of reading glasses or just regular glasses. But it gives you good vision so you can see to drive and see to watch TV. However, if you have near vision to begin with, and you ask me to set you for distance vision with the monocular lenses that are covered through cataract surgery, the basic lens, you will lose your near vision and you will need some help in the form of reading glasses. Some patients have astigmatism, where their eye is shaped more like a football than a basketball. In these cases, these patients you can benefit from a lens called a toric lens or relaxing incisions. These help correct the astigmatism or oval shape of your eyes. If you do not choose correction of this, you will likely need some form of correction in the form of glasses for you to have your best distance vision. Many patients wonder what they can do to decrease their dependence on glasses after cataract surgery. There are several options for this. One option is the multifocal lenses, such as PanOptix, Odyssey, or Envista. These lenses do a great job at focusing the light at near vision, intermediate, and distance. Unfortunately, we can't give you the vision you had when you were 20 years old, where you could take a book and move it back and forth, but these lenses have sweet spots, and they do a great job overall. Some weaknesses in the lenses, if you're trying to read something and it's very dark, if you're at a candlelit dinner and you're trying to read the menu, you'll need to slide the candlelight closer to the menu so you can see to read it, or break out your cell phone and turn the flashlight function on. In addition, these lenses have rings in them. As seen here, these rings help to focus the light at near and distance and intermediate vision. Some patients can see these rings when they go driving at night. So if you're looking to do a lot of night driving, we'd steer you away from these lenses. There are other lenses that may be a better choice. One other lens that's also a multifocal or a bifocal lens, it's called the SVL3. And this does a nice job for patients that don't have a lot of astigmatism, whose pupils are fairly large, greater than 2.5 millimeters, and don't have any inflammation where where they would have a lot of inflammation in their eyes, such as having sarcoidosis, lupus, rheumatoid arthritis. Those would make you not such a good candidate for this lens. But this is another choice. This is more like a bifocal lens where the vision, it has good distance on top and it graduates into the reading by sort of tilting your head a little bit. The main downside with this lens, it has this transition zone. You can see that little curvy part in the middle. Some patients can see this a bit when they go driving at night and they get these little angel wings or looks like little lashes in your vision. So again, if you're looking to do a lot of night driving, we'd steer you away from this lens as well. There's other lenses called extended depth of focus lenses, such as the Vivity or the Symphony, that would be a better choice if you're looking to get an extended depth of focus, extended range of vision, and also the ability to see at night. Those lenses, they don't give you very good reading vision. It's more sort of like intermediate. So seeing to eat your food, seeing your dashboard, seeing your computer. And then if you have your cell phone and you hold it far away and you blow up the font, you'll be able to see that. But patients do very well with night driving with these lenses. They have minimal issues. Finally, I've been doing cataract surgery for over 20 years. I'm very comfortable doing manual cataract surgery. There is the femtosecond laser that helps me by automating certain steps in the cataract surgery, such as making the incisions, helping with astigmatism correction, and then making an opening in the capsular bag called the capsular rhexis. And because the laser automates these steps, it helps to make where the lens ends up inside the capsular bag or the effective lens position more accurate, giving you a little bit of a tweak, a little bit of a boost in your final visual outcome. Also, I wanted to let you know that about 90% of my patients don't need drops after surgery. Your friends may all ask you, how come you're not using drops? We put a little medicine under the soft covering of the eye called Cataract. So you might see a little white dot that will fade over the next couple weeks after surgery, and then the eye might be a little bit red after surgery. In addition, I put a little bit of antibiotic in the eye in the form of moxifloxacin or Keflex, so you don't have to do topical antibiotics. We do give you a little bit of sedation with the surgery as well. Our goal isn't to knock you all the way out, but to have you comfortable so that you're responsive when we ask you uh, to position and to look at the light under the microscope. It's my pleasure to educate you on the different lenses and techniques of cataract surgery, and I look forward to talking with you during your visit.